Hello, we are the fabulous Fairfoot 4 and we are exploring the idea of changing IV catheters every 3 days or only when clinically indicated. So what is an IV? It's the infusion of liquid substances directly into a vein. Intravenous simply means within vein. Therapies administered intravenously are often included in the designation of specialty drugs. Changing IV catheters when clinically indicated can save hospitals lots of money and equipment costs, save staff time, and decrease patients' level of discomfort because they are not constantly being stuck with needles causing pain.
Why don't you hit me with your best shot? Hit me with your best shot. Fire away.
Patients are at risk for infection when IV is administered. Signs such as infiltration, which you'll have cool skin, phlebitis, which you'll have redness, pain, and swelling, are all indicators of prompt removal of an IV.
On my feet again. Hit me with your best shot. Why don't you hit me with your best shot? Hit me with your best shot. Fire away.
Our PICO question is, in patients on 4-tower, what is the effect of changing IV catheters every 72 to 96 hours compared to changing IV catheters only when clinically indicated have on the risk of infection?
The search strategy that we used was the University of Cincinnati Library's website. We used the SANAA database, and some keywords we searched were intravenous catheter, 3 days, and infection. And we limited our search to English literature, full-text academic journals that were written within the last 5 years.
Little hearts like the one in me. Before I put another notch in my.
We used 4 research articles, 3 with a quantitative approach, 1 with a qualitative approach, all with quasi-experimental designs. All the articles we found are of good quality with consistent results, such as the risk of changing IV catheters only when clinically necessary versus every 72 to 96 hours does not change the risk of infection. Also, when you change IV catheters only when clinically necessary, this reduces costs for hospitals, consumers, and insurance companies. Lastly, reducing patient discomfort is a big advantage of waiting until clinically indicated.
Our recommendation is for nurses to routinely check patient IVs and change IVs only when clinically necessary, meaning changing IVs only when signs of infection are present, such as phlebitis, pain, leaking, dislodgement, infiltration, and occlusion. This will lead to positive outcomes because it will save money by avoiding unnecessary sticking, which will avoid patients' unnecessary pain associated with insertion of IVs.
Little hearts like